I'm Helen Butterfield. I'm the Patient Services Manager at the Marlow Medical Group. I'm involved with informing patients of clinics and services, and I'm also involved with CQC and targets.
Helen, why did you decide to work with Carers Bucks?
Well, we realised that we hadn't identified as many carers as we should. We found out from the CQC protocol that we should actually have about 10% of our patients should be carers, or around that amount, and we hadn't got that many identified. We were approached by Carers Bucks to host some information events at the surgery, and we were fully supported by Val and her team at Carers Bucks to do that, and we ran those events at a PLT afternoon where we could invite the patients along when the surgery was closed.
What did this involve for the practice?
So the first event we held was for our Marlow patients, and we advertised that on our website, in the surgery, on our electronic boards, and also Carers Bucks were really helpful in publicising the event around Marlow. It was really good. The first event we had over 40 patients attend, which was more than we'd hoped for, so it was great. We did manage to squeeze everybody in there. And it was really interesting because there was a good mix of patients, some of who knew about Carers Bucks but didn't realise about registering themselves or identifying themselves as carers with our surgery, but also vice versa. We had some carers here that didn't know about Carers Bucks or the other services that were available. So it was really useful. We could register patients as carers, identify them within our surgery on our database. We could inform them of the services that Carers Bucks provide and all the advice and support they're able to give. We were also able to inform them about the flexible breaks for carers, which are set up by Bucks County Council. And additionally, we had Dave Bone from Carers Bucks, who was able to come in and show all the products, the telecare products, which was also really useful for a lot of the patients, depending on their need. Where patients were able to give consent for their carer to have access to their own medical records, we're able to record that on the system, which meant that the GP could share medical information with the carer, which made it much easier for when they come in or book appointments, and the doctor's aware that they're able to have that access. The feedback's been really positive. The GPs are far more aware of patients. There are quite a few patients that they didn't perhaps realise were carers, so that's been really useful. And also the receptionists are aware of when carers come in and book appointments. It's just easier, and also with the medical records access, it pops up onto the screen, so they're able to give out results and that type of thing. So it's made that all much more of a smooth process. We've been able to create a carers register much more easily, which we've done through EMIS Web, so we're able to pull off statistics about the numbers of carers and the situations that they're in. And for what we've gained out of it, it's been really worthwhile, so I definitely recommend it.